Elizabeth Anyeth, a South Sudanese national, is among hundreds of patients crossing borders into Uganda in search of specialized medical care. We found her at Kumi Orthopedic Center, a private specialist hospital in Eastern Uganda, treating bone, joint, spine and trauma-related conditions. Anyeth sustained a serious leg injury following a border accident while in Uganda.
Our people took me traditional work first treatment. So the man for traditional work can work for me. I spent like 22 days. So that 22 days I got infection. So the bone has already infected. And then after she took me to the hospital. So those people from hospital, they've been trying a work, but she has failed. So I done like a money surgery, like a 10 surgery now. Yeah, from Sudan is 5, and here now is 4, and Gulu is 2. Yeah.
Months passed with little improvement, and the pain persisted. In March this year, Anyeth returned to Uganda and sought care at Kumi Orthopedic Center, where she was placed under the care of orthopedic surgeon Dr. John Ekure.
So the time I was in South Ranch, and now here they are different. So I have a lot of infection, but now the infection has improved. So she has to be reduced. So there's no more infection again.
Dr. Ekure is also the founder of the center, which he established in 2011 in honor of his late mother, Elizabeth Opola.
To get the services closer to the other populations that didn't have access to this type of surgery, except getting them in either in Mulago or some other hospitals within Kampala.
He explains that Uganda faces a critical shortage of orthopedic specialists, coupled with high rates of musculoskeletal trauma, largely driven by road traffic crashes.
We are still few compared to our population. Our population now is about 45, 46, according to the recent census, and we are barely 100 orthopedic surgeons in the country.
As a result, the facility attracts patients not only from across Uganda, but also from the wider East African region, especially on clinic days.
Yeah, we see between 60 to 100 patients on a typical clinic day. Yeah, because we start quite early, and we have 4 orthopedic surgeons in this hospital, and then we have 2 medical officers. So we see about 4 patients at every one time that we call.
Dr. Ekure says delayed access to proper care, often due to reliance on traditional bone setters, remains a major barrier to recovery for many patients, frequently resulting in complications and long-term disability.
Traditional beliefs are an impediment to the treatment. We have to work on mindset change. Let them not look at the modern medicine as just some tool for money making. It is about service. But the service will not come cheap, because what we need to use has to be paid for. We cannot depend on one source for everything. We cannot depend on government or blame government for everything. We have to participate and be proactive as human beings and citizens of our country. And that's how we can only get these things to move forward.
He adds that poorly managed trauma has far-reaching consequences affecting livelihoods, productivity, and overall quality of life.
We can't do alone as surgeons. We work with teams. We work as a team. That includes physiotherapists and other rehabilitation experts. We also have, of course, people who deal with other social issues, the psychologists and the sociologists, because trauma is much more complex than just breaking a bone. There are many things involved there. Families can break, communities can get affected, so many things happen.
While her condition is improving, Anyeth admits that the cost of treatment has been overwhelming. Dr. Ekure explains that orthopedics is a highly equipment-dependent specialty, with most surgical implants and devices imported at a high cost.
The implants we use are all imported, and there is no way we can subsidize for this, because we don't get support from anyone, we don't get support from government. We don't get support from any donors. This is by ourselves for ourselves. And so somehow there is a bare minimum that the people who are accessing the service have to pay for and to make it sustainable. And literally, we also want it that way because that's how it can be sustainable, that people must think of how they can improve on their own economic situation to access services like this. Though we would feel for those, the poorest of the poor, for them to be able to access this service. Doctors in private practice agreed on some rates for consultation, but we've kept ours low so that even the poorest of the poor can see, just consult, to get know what the problem is and what it would take. Then is from when they are able to know what it is, if they are not able to afford our care, we refer them to a government health facility where we know there is expertise like ours.
He points to a growing public health burden, citing the urgent need for stronger emergency services, access to joint replacements, management of complex fractures, and better health infrastructure. In Eastern Uganda, many children are living with preventable, life-altering disabilities, cases that routinely present at his facility.
Beyond trauma, we see children who are born with disabilities. We also see children who have acquired disabilities, particularly in this region from injections by health workers or quack health workers. Repeated injections in the buttocks have damaged children's nerves, have also caused what we call gluteal fibrosis. The repeated injections in the buttocks create wounds within the muscles of the buttocks, and those wounds heal by fibrosis, the scarring inside, and that affects the children's ability to walk, to sit, to bend, and to run. There are many of those children in this region. We also see children with what we call chronic osteomyelitis. Chronic osteomyelitis is a disease of poverty, malnutrition, poor hygiene and sanitation. These children, like any other children, play. They play so many games, and slight injuries can lead to infection because they play in dirty environments. All soil everywhere is contaminated. Even the grass has bacteria or agents that can cause infection. And so, because this is a poor region, we have lots of chronic osteomyelitis in this region. And we see many of those children as well. And these diseases, when not attended to, are disabling. And so even their surgeries become complicated. And so we tackle that as well. There are also diseases associated with some, not just associated, I can talk about sickle cell anemia leading to the dying of the head, of the femur. They can also end up with joints, knee joints getting kind of stuck together because the blood supply to the joint, to the knee joint, is compromised by the sickling of the cells.
Dr. Ekure urges Ugandans to adopt positive health-seeking behavior and seek timely medical care to avoid complications from otherwise manageable conditions.
Every disease doesn't have to have one solution. Like, we are an orthopedic center. It doesn't mean everybody has to be operated. Some diseases just need rehabilitation, physiotherapy. Not every disease needs medicine, a painkiller. We have a problem of kidney disease in our country because many people have either self-medicated or many doctors have pumped painkillers on patients time immemorial. And there is also addiction. People look for, I hear, strong painkillers, and they've gone on getting medicines like tramadol. It's addictive. Pethidine is addictive. It's like any other narcotics that you'd find on the streets. These are problems that are destroying many people because when they get pain, they think the solution is to get a painkiller. Pain is only a symptom. You must find out why the pain has come. And many patients also tend to come late. Tend to come late when the solutions that now apply are more costly and more complicated.
The 120-bed facility is now investing in training more specialists as part of efforts to address the country's growing human resource gap in orthopedic care. Walter Mwesigye, NTV.